The impact of the coronavirus outbreak on members of the famed Zulu Club in New Orleans after they performed at Mardi Gras is really sort of helping us focus on the impact of this virus on the African American community in this country as a whole. So you may not be familiar with the Zulu Club, but you've probably seen them. There are 800 members, nearly all of them are Black. And after participating in the iconic parade, at least 30 members tested positive for the virus, and at least 8 have died. So Linda Villarosa is here with more on her reporting. She's a New York Times Magazine contributing writer. Linda, thanks for joining us. The article is long, but it's really, really good. I think you could sort of say it's almost separated into 2 parts. And the beginning kind of takes us through a timeline. What's happening with the Zulu Club as they lead up and get ready for Mardi Gras, and then what's happening with the administration and the messaging that's being sent out to the country, and why members of the Zulu Club felt that it was okay to continue with all the festivities that they had planned throughout the year. But you also really focus on Cornell Charles to tell this greater story. Tell us what happened with Cornell and how his story fits into the broader narrative about the African American community and this virus.
Well, first, thank you for having me. Good to be back. Cornell Charles, who everybody called Dickie, was this beloved member of the Zulu Club. And he had been in for about 10 years, and he was legacy because his father-in-law was also a member. And he was a really behind-the-scenes guy. He didn't like to be out front. He was just like a hard-working, solid citizen. And carnival season in New Orleans starts in January and goes all the way through February 25th. So almost every day, the Zulu Club had an event. They had a ball, they had festivals, they had parties, they had all kinds of events where a lot of people came. And Dickie was often the behind-the-scenes person at many of these events. So that meant he was having contact with a lot of other people, as were a lot of other people having contact with each other, leading up to the parade. At the same time, the federal government knew something was going on with COVID, because at least in February, when some of these events could have been canceled, the administration was still downplaying it. Behind the scenes in the federal government and in the Health and Human Services and the Centers for Disease Control and Prevention, there were people sounding alarms, but it wasn't getting to the top. So the president and even the Surgeon General was still downplaying the threat and basically ignoring it, which allowed Dickie Charles to go to all these events, a lot of other people to go to all these events, and to really get exposed to the virus.
Mm-hmm. So, Linda, I mean, you show this through your reporting. Several officials in New Orleans said they received no guidance from the President of the United States or the CDC. How did this impact New Orleans, but more specifically, the Black community in New Orleans? And it's something that we've seen play out in other communities as well. The mixed messaging at times that has come from the President of the United States, the Coronavirus Task Force, the CDC, very often on different messages based on what the president is tweeting or what he says at one of his numerous press events.
I think for the Louisiana Department of Health and even the City Department of Health in New Orleans, it was confusing, since we've known for a long time that this was going to have an impact on the Black community. And so even behind the scenes in other ways, there were politicians saying, please release data on what's going on in the Black community as far as COVID. Please release data, about the impact on Black and brown people in the United States. And so that data was very slow to come, even though there was growing pressure. At the same time there was pressure to release the data, there was an underlying fear that it was for sure going to show that there was a disproportionate impact on the Black community, but there was also fear that Black people would be blamed in some way for what was going on with us.
So I mentioned that I kind of felt like the article almost had like 2 parts to it. One was a timeline, but the other part has to do with racism and healthcare in this country, and that these things were already in place. That Black people, when it came to healthcare and health outcomes, were already vulnerable, which means that they were ripe for the negative impacts of the coronavirus. Can you talk about that part?
So, under the radar, that conversation had been going, which was what prompted me to start the article in the first place. I had been on a Facebook Live group where people in public health were saying there are long-standing disparities in healthcare and inequality. The fact that Black people are treated unfairly in the healthcare system, that we have higher numbers of underlying conditions like asthma, like heart disease, like hypertension, like diabetes, like obesity, that are, some of it is about personal responsibility for sure, but we all know that. What is less discussed is the discrimination that we face in the healthcare system. I think the last time I was on your show, I was talking about the 1619 Project, where I traced discrimination in healthcare back to enslavement, and then all the way to the present day. And the worst of the myths is really that Black people can withstand amounts of pain that white people can't. And so we're treated unfairly in the system for a variety of, reasons that we're there. And that has an impact on our present day healthcare. And so it's complicated, but it's all wrapped up into the fact that it's not a giant surprise that we live fewer years, that we have some of these underlying diseases that make COVID worse if we're not being treated fairly in our own healthcare system.
And another historical antecedent you point to, Linda, is you walk us through some of the health studies, and I say studies in quotes because these were not real studies, but the treatment, the Tuskegee study of untreated syphilis, many of these quote-unquote studies contributed to the mistrust of doctors in the healthcare system in the African-American community in the United States. So give our viewers an understanding or just a slight insight into what those studies were and how they may have contributed to the mistrust of doctors.
So the Tuskegee syphilis study began in the 1930s and lasted to the 70s. And so the federal government, the U.S. Public Health Service, recruited Black men who were dealing with syphilis, left it untreated, even though there was treatment, in order to understand the course of the disease. So that meant people suffered and died of this disease for no reason. It was just for science. These people were apologized to. Their descendants got money because it was a terrible time in history. But people haven't forgotten that. What I find even kind of more striking is there have been other kinds of studies, full-blown reports, that talk about mistreatment in healthcare when you're Black. And then also current studies look at pain management. Current studies look at the way we're treated, whether we've broken a bone, having a C-section, in for some kind of other kinds of surgeries where we don't get proper pain management or our treatment isn't equal. So you can look back at the Tuskegee study and think, oh, Black people don't trust the system. But you can also look at what just happened. Because if we are not getting treated fairly now, that is probably the most, the memory that will keep you out of the system, and also not have you trust medical information that's coming out. And then on top of it, when your president is saying something entirely different, it just caused a lot of confusion.
And, not just the president, Linda, we had the Surgeon General, kind of talk about the underlying conditions that are present within large portions or, a certain segment of the African-American community. But he also sort of appeared to certainly tell people to take personal responsibility for their health care while ignoring this whole, everything that you just pointed out, that we have a long, long history of discrimination within healthcare here. And sort of the messaging seems to be over and over again, you should be able to fix this yourself. Like, why can't you just make better choices?
I don't dislike the Surgeon General. I think he made some unfortunate points, and he's a very sympathetic figure because he also has hypertension, he has prediabetes, he has asthma, which he's talked about in a really lovely way. And he's relatable, but the statements that he made saying to the Black community, take responsibility for your own health while ignoring the discrimination that is present in the healthcare system in our society that adds on to the COVID problem was unfortunate. And he he did. He walked it back. But I think on top, his mixed message, being a Black person, made it confusing.
And I want to ask you just one more thing too. You sort of point this out, but you don't dive too deep into it. But I thought about also the misinformation that's out there, and you sort of point out that at a certain point there was kind of this misinformation about, you know, African Americans can't really get this virus because melanin protects them. And I wonder if you feel that in like the wake of sometimes like an information vacuum when it comes to information about the coronavirus, all this misinformation gets poured in, and that also, you know, didn't help minority communities, in particular Black people in this country.
Well, what I was happy about, so there was, at the beginning of this, there was misinformation about, you know, saying melanin protects us from COVID, which is wrong. And I think it was really wonderful because Idris Elba was diagnosed with COVID, and he went on and said, please don't listen to this. This is false information. So, you know, comparatively speaking, this got shut down quite fast. HIV/AIDS had the same kind of misinformation and mythology and conspiracy theories, and it lasted much longer. This was shut down pretty quickly, which I thought was really good. And I think we've had experience with infectious diseases and these kinds of myths that spring up from the community, partly because of real distrust in the healthcare system.
Linda Villarosa, it's always so great to have you on our air to talk about the reporting that you've done around this issue and others like it, because I think it's hard for people in this country who are not Black and brown to understand the systematic and the systemic issues that have plagued Black and brown people in this country for generations. And if you live in it, then you know it. And that is what we've been talking about, the suspicion that arises whenever something like this occurs, which is not helped by public officials, including the President of the United States, spreading misinformation. But it's hard to relate to it if you've never experienced it. If you live in a part of the country where there perhaps are not a lot of Black and brown people in your community, you would not know some of this. And so I'm glad that you're able to share your reporting with us here at CBS News. We really appreciate it. Always great having you.
Thank you very much.